Ну и теперь я воспользуюсь возможностью пригласить на трибуну доктора медицины Ханса Петера Хауга, который приехал к нам из Германии специально для того, чтобы поделиться своим опытом. Город Форцхайм, наиболее известный, опытный специалист, который имел возможность работать с различными лазерными приборами и технологиями, поделится сегодня своими впечатлениями от SmartSurf. Это новинка компании Schwind. Пожалуйста, welcome.
Dear colleagues, thank you for your kind invitation to join this Congress. It is a great honor for me to be here in this famous clinic. My teacher in ophthalmology, Professor Mackensen from Freiburg University, was a very good friend of Professor Fyodorov, and I had the chance to meet him personally a long time ago. Both were pioneers in multiple microsurgical techniques. My topic will be about SmartSurf. SURF stands for surface, a one-step transepithelial photorefractive keratectomy. Talking about corneal refractive laser surgery, up to now there are 3 different techniques available. First of all, lenticle extraction, known as relax smile, using 1 femtosecond laser, creating an intrastromal lenticle that will be extracted by a side cut. And second, LASIK. This technique needs either a mechanical microkeratome or a femtosecond laser to create a corneal flap. The optical ablation is then performed by an excimer laser. And third, the superficial corneal ablation, known as PRK, removing the epithelium either mechanically or applying alcohol, or, and this is my topic, remove touch-free the epithelium and carry out the visual correction in 1 step by 1 laser, 1 excimer laser. Here in this slide you can see in which component of the cornea the different techniques take place: lenticle extraction, LASIK and PRK. You can see the difference regarding the ablation profile in superficial corneal ablation in PRK mode. First, only optical ablation by conventional PRK after removal of the epithelial. And the second profile on your right hand side shows the total amount of ablation in trans PRK. From now on we will call it SmartSurf. SURF stands for surface. Both epithelium and stroma are removed in 1 step in 1 ablation profile. As taking in account literature data estimating the central epithelial thickness of a normal virgin human cornea to be 55 microns in the center and 65 microns 5 millimeters from the center, all the ablation profiles were calculated. SOCT measurements show a very small standard deviation in human corneas. The refractive curvature will remain the same, independent of the epithelial thickness. The refractive curvature, taking into account thinner epithelium, will induce only a deeper stroma ablation without any influence on the optical zone. Thicker epithelium reduces the optical zone, so we suggest, depending on the refraction, different optical zones. Treatments by SmartSurf under 1 diopter should not be performed, as well as superficial retreatments after PRK or LASIK. We found in some cases during a retreatment procedure an epithelial thickness of more than 80 microns in the center, so SmartSurf for retreatment brought no effect. Regarding an ablation profile of -4 diopter treatment on a 6.3 mm optical zone, The volume of ablation in PRK is 1,268 nanoliters, and in SmartSurf 4,975 nanoliters. And this means a 4 times higher volume in SmartSurf, with an ablation depth of 57 microns in PRK and 112 microns in SmartSurf. The SmartSurf procedure has many advantages that will be discussed later. The main disadvantage is a higher total energy load delivered by the excimer laser in SmartSurf. The epithelium needs 20% more energy to remove than the stroma. The Schwind company has given in ITEC a good solution by his Amarius family from 500S to 1050S using a very small laser spot of only 0.54 mm spot size with a super Gaussian spot profile operating on 2 different energy levels by ablating epithelium and stroma using a thermal controlled process that prevents damage to the surrounding corneal tissue even at very high ablation speed. ITEC ensures that the laser pulses are distributed in a thermally optimized, dynamically adapted way that gives the individual position on the cornea sufficient time to cool off. You see on the left side the thermograph researches. Following pulses can thereby approach an already cooled position faster. Smart Pulse technology uses a sophisticated geometrically model based on a fullerene structure. The big advantages of SmartSurf is the absence of a flap, thereby eliminating all flap-related complications. You have complications in femtoLASIK and you have complications on mechanically flaps. SmartSurf is non-invasive, so touchless, with less stress on the cornea, and gives a potential for more biochemical preservation and stability. It is a one-step procedure with a fast visual recovery. In my eyes, SmartSurf is the ideal superficial technique for low to moderate myopia and hyperopia and for thin corneas. For retreatment, SmartSurf is no option, as long as there is no really reliable methods available to measure topographically the epithelial thickness on each point. SmartSurf by Amarius series laser can be performed even for higher astigmatism and for all kind of aberration-free, aberration-guided treatments or cyclotorsion control procedures. This graph shows the results of a multi-center study of 1,159 myopic eyes for -1.5 to -6.5 diopters with an average of -4.5 diopters. Hyperopic results are similar. In my clinic, we use the Amarius 750S by Schwind iTech solution concerning a residual corneal thickness of minimum 280 microns, and I personally like to have an ablation area of at least 7 millimeters, for this improves the visual quality, especially in night vision. In all cases, 0.02% mitomycin was applied for 2 minutes, a bandage lens for extended wear with a flat base core because we flattened the cornea by the laser was fitted. All bandage lenses were removed the 3rd postoperative day, and during the period of lens wearing, topramycin preservative-free drops to avoid toxic reactions 4 times the day were applied. The post-op regimen includes topramycin, dexamethasone and diclofenac drops for 1 month. No diclofenac drops with contact lens, please. You create sterile infiltrations. And 0.15% hyaluronic acid for 3 months as often as possible. And then I reduce the frequency of application monthly. Besides a sophisticated laser system, the post-op regimen is in the same way important. Latest studies show by SOCT measurements that after conventional PRK procedures, the stroma is completely covered with epithelium within 3.6 days, whereas the stroma is covered by SmartSurf within 2.4 days. The reason for this might be the smoother surface of the stroma and the smallest possible area of erosion. Within 4 to 5 days, the epithelium reaches the maximum value. With the new SmartSurf technology, a higher vision performance in the early postoperative stages was observed. And this is the reason why we tend more and more to bilateral SmartSurf. As conclusion and take-home message, the SmartSurf treatment, there is no touch, no suction, no incision, no cut, a significantly faster vision recovery comparing to conventional PRK. The results in low to moderate refraction errors are predictable and stable by a strict postoperative treatment. In this procedure, we see a revival and evolution of the superficial corneal laser treatments. Thank you very much.
Уважаемые коллеги, вопросы есть к доктору Хаугу? Пожалуйста.
Доктор Хауг, скажите, пожалуйста, применение метамицина в вашем процессе является обязательным? Второй вопрос. В каких случаях вы его применяете?
No. Mitomycin is, you see, we have in Germany sometimes strict regulations, and sometimes they ask to avoid haze, and they recommend mitomycin, but I'm not a really fan of mitomycin.
Понятно. И тогда третий вопрос. Эпителизация роговицы, таблица, которую вы привели, это с метамицином или без? Вот у вас при обычной ФРК 3,6 дня, а при вашем методе 2,4 дня. Это с метамицином?
This study was performed with mitomycin.
Спасибо. Ну, если можно, еще один последний вопрос.
Пожалуйста, один, да.
Да, один. Значит, вы свою методику представляете как одноэтапную. Известно, что коэффициенты абляции эпителия и стромы очень сильно различаются. Как вы это учитываете?
I didn't really understand.
Еще раз, пожалуйста. В чем разница, наверное, между методиками? В чем разница между стандартной методикой и методикой, которую вы сейчас рассказывали?
They calculate the first 55 microns with a high speed, and the second, the optical ablation with a low speed to have a smooth surface.
Мой вопрос был, при переходе от абляции эпителия к абляции стромы параметры излучения меняются или нет?
Все. Понятно, да? Хорошо. Dankeschön.
Thank you.
Dankeschön.